Okay, so for those of you who haven't met Kwak or have heard, Kwak owns Pixis Biologics. And he has a chemist over there, which is the brainchild of our technology of being able to turn an ingredient into 100% bioavailable in a water soluble. And so Kwak also, with Brian Reed, owns the MLM, which is BioRains. And so for the technical questions on products and things, it would definitely be Kwak. So let's go ahead and have Kwak, if you would just maybe, just really quick for those who haven't heard it, maybe just share your journey of buying a biotech, and then we can open up for some Q&A.
Okay, sounds good. How's everyone doing today? I apologize. I'm in the process of driving right now, so you guys got to bear with me here. I hope you guys can hear me clearly. Okay. So, yeah, my name is John Kwak. I am one of the owners of the Biotech Lab. I got involved with the Biotech Lab over 10 years ago when I met a brilliant scientist. He was probably one of the smartest guys I ever met. So when I met him, we decided to open up a lab together. We do protein peptides. We are a drug manufacturer, but about 6 years ago, we got in. We do protein peptides. We do stem cell growth factors, IGF, insulin growth factors. We do hemoglobin. We are a drug manufacturer. But about 6 years ago, my chemist's father his dad was terminally ill. He was given less than 3 months to live. So my chemist went crazy trying to find a solution how to help his father. When the doctors all given up, Mike wouldn't give up. Okay. So what he did was there a lot of research, and what he found is one of the compounds called curcumin. You guys are all probably familiar with turmeric, okay? The active ingredient of turmeric is called curcumin, and it's one of the most powerful anti-inflammatories when it comes to herbal spice. So he heard a lot of research being done on it, so he gave it to his father, and it didn't help in any way or form. So what he did was he was like, hey, wait a minute, maybe I need to highly concentrate this. So he made a kilo of curcumin and put it into a pill form and gave it to his father. Still didn't help. So what he realized in India has been taking it for so long, it's in their bloodstream. So if imagine this, in the baby bottles, when they're born as a baby, they put it in the baby formulas, as well as they celebrate it yearly with it, as well as they consume it on a daily basis, which is their national food curry. Okay, so it's in their bloodstream. So he decided, hey, I need to get into the bloodstream of my father, because when you take regular curcumin, it has to all process through the digestive tract into the liver system. So he turned it into a water soluble that he started injecting into his father, and it started giving him some relief. At that point, he's like, wait a minute, if I can do this with curcumin, I can do this with CBD. So he turned that into a water soluble, and he combined both those two together. The synergy it had, it literally kept his father alive for another 4.5 years. Okay. That's how the whole technology started. He learned the technology of turning any oil base into a water soluble. And you'll hear other companies claiming to have water soluble. What that technology is called is liposomal or nano. What that technology is, tiny little particles of oil floating around inside the water. We are not that technology. We're a true water soluble. When we say water dissolvable, it truly bonded with the water on the water cellular level. Okay. So our technology is completely different than anybody that's out, any company that's out there. We have not got a patent on it yet. We are working on a patent, but we did clinical studies on our water soluble. When you take our product, your body recognizes as water, so it flows where water flows where the water's. It goes into your body. Okay, say that. So with that in mind, we did a clinical study on 20 different individuals. We tested water soluble nanotechnology. We tested our technology, and we tested oil. And we did a EEG test. This is a DARPA-funded, FDA-approved test. When we did the test, we did a 5-minute test, a 15-minute test, a 30-minute test, and an hour test. And when they took oil, there was no improvement whatsoever in the blood in the brain frequency levels, as well as nano. Okay, but when we tested our water soluble, within literally 3 to 5 minutes, reduction in brain wave activities were reduced from 30 to 70% on all levels, on all 9 different sectors of the brain. Okay, the neurologist was shocked. He says, normally you take a drug, it'll lower one, but the other ones would spike. Okay. With our technology, we lowered every single sector of the brain on all areas of the brain. So we created something very unique and amazing here. We're passing the blood-brain barrier. So that's how we got involved. So about a year and a half ago now, a doctor came to us and said, "Why aren't you guys selling this to the general public?" We never thought about it because we've been selling in the medical world for over 6 years. Okay, I have contracts with South Africa. We're in deals with Australia as well as the UK. So we made it for a doctor, and when we started selling to a doctor, Brian came to us and says, "Hey, do you guys have a CBD product?" And said, "Sure." We gave it to him. Brian is the CEO of BioRain. After we given samples to him, every time he gave it out, 5 people would come back. 5 people would come back. So Brian said, "Hey, could you guys make me a product?" And we agreed to make him a product. 3 to 4 months later, he came back and says, "Hey, I need an exclusive." Okay. At that time, we're like, "No, why should we give you an exclusive?" And that's when he made a deal with us to give us half the company to, the laboratory owning half the company of BioRain. That's how BioRain's all started. Now, aside from that, do you guys have questions that I can answer?
We do have questions. Who would like to be the first? Everybody's muted. Oh my gosh, if you guys are asking questions, I'm sorry, you're muted. You have to unmute. Okay, well, they're unmuting. I have a question.
Okay.
So ours crosses over the blood-brain barrier because we have that technology that can turn CBD into a water soluble.
Mm-hmm.
Does liposome or nano cross the blood-brain barrier?
It does not. Because it's, no matter how you look at it, it's still oil. And it still has to process through the digestive tract and the liver system.
Okay, so then, I don't know if you know this, but for people who say ours is bioavailable, then ours is bioavailable too. So what is the difference if theirs is bioavailable in a nano or in a liposome?
Well, I've heard liposome where it's up to 20% absorbency. With our water soluble, they're tiny little particles. Well, our technology, we're truly bonded with the water on the water cellular level. So it's part of the water. It's not a separate entity, okay? It's really part of the water. So that's what makes us so unique. There's only 2 companies, by the way, there's only 2 companies that knows how to test our water soluble. Which is called ABC Testing and Brightside. Brightside and ABC Testing are the only two companies that actually have an SOP to test our material. Because anywhere else you send it to, if you tell them this is CBD, they'll test it for oil. Okay, and we have 0 oil in our products. So that's what makes us. I mean, the SOP that they created for our products, they have to try to separate it from the water itself, which is very difficult.
So does our product start off as an oil, but then with the technology, we're able to have it be water? Is that it?
Yeah. Well, here I can get, which is there's 3 forms of CBD when you extract it. Okay. First is crude. Okay. Crude is the purest form. It's like the sap of the plant itself. We can turn that into a water soluble, but we've also can turn isolate or distillate. Isolate is what is dried up oil. Okay. We can turn that into water soluble, as well as distillate, which is oil. Okay. With any one of those formats, we can turn it into a water soluble using our technology. We bonded it. We bonded the CBD molecule itself with the carbohydrate. Okay, and I consider that a medical sugar. Okay, it's not a real sugar, but it's a carbohydrate.
Okay. That is absolutely fascinating. I mean, it just really is. That just kind of is big. And then there's a question on the chat. Are there contraindications or not recommended for people to take with any other medications?
I mean, this is all natural products. Okay. I've always say if someone has really heavy medical conditions, always consult with your doctor. And you also got to tell them it's not oil. Okay. People that are on dialysis, they cannot take CBD oil. Okay. With our product, you can, because it doesn't have to process through any of the organs, because it's not oil.
Okay. And what is the significance of taking a CBD that has oil in it, like a nano or any of these, even if they say they're water soluble, if it has oil in it, you're saying it still has to process through the liver?
Yes. And they're just tiny little particles of oil. Okay. I know there's a lot of feedback on, of liposomal, how it works. Okay. But if you had got it tested, they will detect that there's oil in there. Okay. That's what, and usually when you take it, it does not pass the bloodstream. There's no way it can. Okay. Because it's technically considered oil. And there's NIH paperwork, and instead of reading blogs, always read the NIH paperwork. Okay. National Institute of Health or PubMed when you come up to reading articles.
Okay, so NIH paperwork or PubMed?
PubMed. I mean, there's a lot of talk about, with CBD. CBD is CBD oil. Okay. CBD is good. The carrier also has some issues. Okay. When you consume on a daily basis, I mean, when you consume it on a moderation, it's fine. But when you over consume oil, okay, it all has to overwork your enzymes. I mean, overwork your liver. Okay. So with any type of oil, it doesn't matter if it's CBD oil, if it doesn't matter if it's omega-3. When you consume oil, it all has to process through the digestive tract into the liver system. So moderation is a key. Okay. There's only one drug approved by the FDA, which is called Epidiolex. Okay. Their biggest warning is that the CBD works for stopping seizures, but their biggest warning, their biggest side effects is liver damage.
Wow.
Okay.
There's another question. They want to, Tomoko's asking, how is the product able to affect the blood-brain barrier in 120 seconds?
Okay. Well, with our product, I mean, less is more, okay? This is going to be a little confusing. When we say there's 1,200 milligrams of our CBD complex, okay, there's 1,200 megs of our CBD complex in the product itself, but only 2% of that is active CBD, okay? So out of 1,200 megs, you're talking 24 megs, which doesn't, I mean, to the average consumer, they're like, how is that even possible? If there's only 24 megs, how is it affecting the body? Well, since it's in the water system, it's passing the blood-brain barrier. You don't need as much. When you take oil, the absorbency is 7 to 8%. Okay. When it passes through the digestive tract to the liver system, what you get is microdosing as well, because it has to process through all those intestines. I mean, to the organs. With our process, we're just bypassing that. Okay. So we're doing microdosing. If you ask any doctor, if you were to take less of a product, okay, and get the same results, is it better for you? And every doctor will agree with you, okay? Less is more, because the more you take, the more side effects you have.
Okay. I actually have one other question for you. I've got some friends with autoimmune disorders, and the medications that they're taking requires them to measure certain vitamins. Primarily it's vitamin D. How would you calculate that with the products that you have? How do they figure out how many IUs they're actually going to be consuming of the vitamin D?
That's a good question. I mean, when it comes to our products, it's a proprietary blend, and what we do is microdosing. Okay. And I'm not a doctor or a chemist. I might own the laboratory, but that's a question that I can get back to you. Let me ask my chemist. Okay.
Okay. That would be.
Yeah, but I know it's a proprietary blend. I know that we're microdosing, but I don't know, if they're limited to a certain level. That's something that I gotta ask my chemist.
Okay. Yeah, because I know because of how effective it is, I wasn't sure if that changes the dosage that they're required to take. I wasn't sure how that all works. I just know that they're required to report back how many IUs of vitamin D that they're taking.
I mean, we're talking. I mean, nanograms. Okay, I mean our technology, we're water soluble, so we don't use as much, but it is in the water system, so it's a complete different ball game when it comes to, if I told you how many megs are in there, it doesn't even
Right.
matter because it's water. It's,
No.
you know, yeah. So let me
Yeah.
find out on that question for you.
Okay, that would be great. And I'll see if I can find out what it is that they're taking that requires them to have that kind of dosage. Because
Uh-huh.
my hunch is they have to take that measured amount to make their medications that they're taking effective, or at least that's my understanding. So,
Okay. I mean, I know for with our products, it's microdosing. It's literally microdosing.
yeah, okay. No, if you're able to calculate that or figure that out for me, that would be fantastic. Because I do have, actually, I have two friends with MS who were asking me that question because they're very interested to try the product, but they're hesitating because of that dosing requirements. So,
Completely understandable.
There's another question asking, is it dairy, soy, and gluten-free?
Yes.
That's what I thought. And we also are putting, is it that we're putting the bunny rabbit on the product to show that we're cruelty-free, correct?
At this current time, yes. But here's the thing: we are going to be doing PK studies. Okay. The pharmacokinetics studies of our, of our viability. So we might be doing some type of testing. That's the only way to do the testing.
Okay. And then a prospect asks, can you provide third-party lab test results or a certificate of analysis?
We do have it, but we're right now we're not releasing it because of the fact that we're not completely we're right now we're in the process, because in that COVA it kind of explains how our water soluble works. So till a patent is it's pending, or let's specified requested, we'll edit some stuff out. But we should be releasing those.
Okay.
I actually talked to Brian about that, about releasing our paperwork. We do have the materials. We have COAs for the material itself, but each individual product we have not released that yet, because it does explain on there from the lab that this is a water soluble, cannot be done as a regular test. Okay.
Okay.
And so until we get some type of verification from our lawyer that it's okay to do, because we're afraid someone's going to use that and try to take our technology.
That makes sense. So the patent is pending, but you've applied for the patent, correct?
We have not yet. We're discussing with a patent attorney that actually is a scientist and a doctor.
Okay.
And
So
he's actually trying to come up with a way how to protect this thing.
got it. So
And
that why on the website it's a little obscure a little bit because of that?
Yes. And on top of that, I mean, right now, because of our technology, this technology that we have, it doesn't apply to just CBD. It applies to our technology of turning anything into water.
Yeah, we definitely want that protected.
Yeah. And trust me, I've been offered big money already.
Wow. So another product question is, what is the difference between full spectrum and broad spectrum?
Okay, full spectrum has the full plant. Okay, the terpenes, the THC has the whole full plant. Broad spectrum has the full plant except for the THC. Okay, the THC levels is supposed to be under 0.3, which our product for the full spectrum is 0.00243 or something like that. Okay, it shows almost non-detect, but it's still strong because it's in water form. I mean, I'll give you a scenario. I did a THC version of our water soluble. Okay, we work with a company called Zenibus, and we did a test run for them. And their issue was that when they make a beer in Canada, okay, it takes them 30 to 40 minutes to get high using the THC. Okay, using oil. So they don't know how to control it. People drink another beer. I don't feel nothing, so they drink another one. I don't feel nothing. They drink another one. By the third beer they have, it's in their system, and it hits them 40 minutes later that they drink so much that they're high for 24 hours. Okay. When they tested our water soluble using microdosing, okay, under 0.8, okay, they got the entourage effect within literally 5 minutes, and it lasted 30 to 40 minutes. Okay, so it's very unique in how our product works because it's in and out of your system. Oil, if you were to take oil, it does store in the fat. Okay, our product does not store since it's water; it's just in and out.
So for somebody to take our product, and if the scans that we show on our website showing it crossing over the blood-brain barrier, that was in the product with no THC, correct? But it's still
that is correct.
And
there was no THC.
Okay, that's fascinating. And so then, how long does the product last in somebody's body, or does that change based on the individual's metabolism, or is that not even it doesn't matter because it doesn't go through the liver?
It doesn't. I mean, I've had numerous talks with my chemist about this. We believe it lasts about 4 hours. Okay, but we've only tested up to an hour.
Okay, lasts about 4 hours. And then someone is asking, are there any artificial ingredients in any of the products?
Aside from lean, lean does have artificial flavoring for now. That we're trying to get the flavor a little bit different because of the fact that it has sucralose. Okay, we couldn't get the amino acid taste out of there. Okay, so they did add something strong, but we have been working on a new formula trying to get all natural products.
Okay, and then they wanted to know that.
And the gummies and the lean. Okay, those are the two products that had artificial.
Perfect. And then question from Canada is wondering if using the hemp seed oil, trying to, you guys are in the process of trying to use hemp seed oil and putting it into a water soluble. The question is, will that change the effectiveness?
No. We're going to make it, my chemist is going to make it where it's the same thing as what we're doing now, but having where if they wanted to test it, they can see that it's made from hemp seed. Because our content of CBD is very low, okay? When they test for it, an actual lab tests it, there's only showing 2%. And with 2% with normal oil, no one will get any effects from it, okay? But with our water soluble, it's a complete different, a way of delivery system. So it does affect the body a lot more, which I think we're trying to solve a problem that we can do throughout the world, okay? Which we're working on right now.
So the question is someone's asking, why are you choosing to use hemp in Canada over CBD? And is it the same thing or is it different?
Well, here's the thing about Canada. We can't ship CBD across countries to Canada. Canada made an official rule where CBD is legal in Canada, okay, but the product has to be made in Canada. And at this point, we're not sharing our technology for anyone to reproduce our technology at this time.
Okay, and then someone was asking about the patent. How long does that typically take with the application process and all of that? What do you kind of have a time frame?
I think 6 months.
Okay. Okay. Any other questions for Kwak, you guys?
Is there a possibility that patent will not, for some reason, go through?
No, I mean, nobody has what we have. I've been offered big money from pharma companies. It's just a matter of timing and just getting it. We just want to make sure that we lock down every little angle on our patent because anyone can change 10% of our method and then say that they discovered it. And I'll tell you this too. We made a injectable version of our product. Okay, that's how it was originally, invented. Made for. But if you were to say, liposomal or this nanotechnology, can you inject it? No. With our product, you can. Okay. I have a curcumin version. I have a CBD version that we do sell it on a medical level. with injectable vials.
If there's another question, if someone has the full spectrum CBD, even if the THC is, not in there,
Mhm.
the question is, do they feel the same? Would they feel that same effect?
You know what I tell people? If you want to really feel it, go into a nice, quiet room. Okay. Take our product. You'll literally feel your head change with literally two to 3 minutes. Okay. And you'll get the full effect within 5 minutes. But if you go into a nice, quiet room, if it's if you're in an open environment, you're not going to feel it as much. If you're watching TV, you take it, you're not going to feel it. But if you literally go into a bathroom and just take it and just sit there, you'll feel it. You'll feel our products.
And then one more question. With working on the technology for getting the hemp seed oil into the water soluble, do you have an idea or maybe a time frame on when Canada would be getting Limitless and some of those other products that people are having such a wow factor with?
We are working on it as we speak. I know with this whole coronavirus thing, it's been a real nightmare for everybody, even our lab. I say that, I don't know. I think we're like a month out.
Oh wow!
I know I got my.
It's going to be longer.
I got my.
That's amazing.
No, I got my chemist working. He's been working on it because we've been trying to launch into Canada.
That's outstanding. One more question, and I know, and this is for Canada, but
yeah.
For Canada we only have biodefense right now, and the question.
No, not true. No? We have Limitless. We have Limitless. We have Dermafect. We have the day, and we have the sleep.
For Canada?
Yes.
Okay. Okay. I thought there was CBD in that. Okay, hold on. We gotta. How are we able to?
There is no CBD in those. We made a special version just for them.
Oh, and how do they order that? I guess I need to.
If you're in Canada, you can.
So wait a minute. So because I noticed when I signed up and I logged in, there was more than just biodefense.
Yes.
So all of the products that are listed for Canada, none of that contains CBD. And
yes.
Anyone can hear it? Oh my goodness.
Yes.
What? What?
Yeah.
I gotta tell you, Kwak, you just made my day. Wow.
So yeah, I mean, we do have products that are being sold in Canada right now. They are they are stocked.
Okay, so if somebody in Canada goes to the replicated site, they can order anything they see, and it will be without CBD because you formulated it for them to get it.
Yes.
That's
there's only 5 products. 5 products: the day, the Limitless, Sleep, and Dermafect, and the biodefense.
Wow.
That's very exciting. Dawn wants to know if there's a tolerance buildup. Is there a way? I would say no because we don't go through the liver. But is there a tolerance buildup with the product? Do you suggest smaller doses at first, or is there no such thing as a tolerance buildup with this product because it's water?
That's something I need to ask my chemist. I don't want to give you guys wrong answers, but I mean, I tell people to start slow and just work your way up. And I also tell people, I don't care if you're sick or not sick. Everybody should be taking the daily. That curcumin is amazing. Okay. And you can look up curcumin with the NIH. I mean, there's government websites. They're doing clinical trials on, terminal illness patients using curcumin.
Okay. Any other questions, my friends? If you do, unmute real quick. Otherwise, we can let Kwak go. I'm excited. I'm excited about what we've got here and where we're going. So anything else, Kwak, that you have that maybe you could give us a little sneak peek on, or any inside intel that you can give us, or are your lips sealed?
I mean, I'm excited about the future of BioRange because we do have, you know, awesome products. I truly believe in all the products that we make because of, you know, my chemist. I mean, the guy is brilliant. I can't emphasize that enough. I mean, when I first met him, I mean, I think I'm pretty smart, but this guy just blew me away. Okay, and he's done amazing things for. I mean, if you knew what my company did on a regular day basis, I mean, we treat terminally ill patients. Okay, and that's all he focuses on. He doesn't care about money. He doesn't care about fame. He just cares about making products that actually work. And I don't know if you guys heard Mike's story of, you know, his video or his voice. Have you guys listened to it?
Some of us have, yes. Van has shared that with us.
Yeah.
It's pretty powerful.
Yeah.
Yeah. I mean, the guy's an amazing person. He's very private. He just wants to be left alone and just do his work.
That's awesome. Okay, well.
So I'd like to say welcome, everyone. If you guys have any questions, feel free to ask. And I promise I'll get you that answer about, you know, the dosing.
Thank you. I really appreciate it.
Thanks, Kwak and Dana. Thank you so much.
Thank you.
Okay, well, you guys take care. It was a pleasure.
Thanks
Talk
so
to you guys
much.
soon.
Okay.
Stay safe.
Thank you.
You too.
Okay, bye-bye.